Hey, good afternoon. This is Michael with Hear Clear America, and this is my first insert for the new YouTube channel. And today I wanted to talk about something that I come across on a daily basis, and it is quite common, and that's how to save yourself some money by properly cleaning your ears. More than often, people come in and they state that they can't hear well. And another thing is that they clean their ears regularly. But as soon as I look in there, it's another bowl game. So I find myself in the position of advising a client and counseling them on what they can do. And one of the things I like to tell people is I won't tell you anything that I wouldn't do to myself, or I won't tell you anything that I wouldn't do to my own mother. And I love my mother. So, anyways, let's talk about it. Ear health is super important. Now, wax, okay? We want to talk about where does wax come from because wax is something that is brought up a lot and I see a lot of. Um, Wax is a natural protective uh, mechanism in inside of the ear, and it the technical word is called cerumen. Um, and there are anatomically there are two glands inside of the external auditory meatus, which is your ear canal, and one at the top and one at the bottom. And the top gland is called the apocrine gland, and what it is a modified sweat gland. And the bottom gland is the ceremutus gland, where the term cerumen comes from. Um, and they both secrete substance, okay? And that substance mixes with shedding dead skin cells and creates what we call, or are commonly as known as wax. And the other purpose, one of a couple purposes of earwax is to protect anomalies from getting to the eardrum, including some of the hairs that you might find inside of the canal. But another purpose is that it is a pH balancer, so helps prevent from infection. Um, so totally removing wax or over cleaning is not good either. But you definitely don't want blockage happening, and you want to have a clear passage to the eardrum so that sound can get where it needs to. Um, so I have a few items with me today that I use regularly, and I'm going to discuss what they are and what to do with them. Um, so first of all, if you have ever punctured your eardrum, you should not put any liquid in your ear. Okay. Now, if you have a professional like myself, I'm a nationally board certified hearing instrument specialist. You can also go to an ENT or an audiologist, or sometimes your family doctor will do it. But if they look inside of your ear with an otoscope and they discover that there's a clear opening right into your eustachian tube, or perforation as we call it, then liquid is strongly not advised to be put in your ear canal. So you may want to use an earplug, while you shower or when you swim. Okay. If you've ever had liquid get into your eustachian tube, then you know what I'm talking about. It is not a comfortable situation. All right. So, but generally, if you have perforated your eardrum and it's been a long while, usually it will heal over. There are generally known as four layers to the eardrum, and technically, um, two or three of them would heal back. It never goes back fully. This does change the way that you hear. It usually ends up as a scar. scarring on the eardrum and stiffens the eardrum, causing a conductive component. But if you have fully intact eardrums, this is what I'm about to tell you is perfectly fine. Now, one of the biggest things that I see that shows up is misuse of a Q-tip. You know, you go to a doctor, the doctor tells you, don't put anything bigger than your elbow into your ear. Well, I agree with that, and then I do disagree with that. I'm a teacher, you know, an educator. So, you know, if I were to hand you a hammer and you've never used a hammer before, and I send you out with it and not show you how to use it, you're probably going to bang up your fingers and it's going to really discourage you. But if I say, here's a hammer, here's a nail, this is how you hold it, this is the task you're supposed to do, do not deviate from that, don't break the rules, then you're most likely to be successful to achieve that task, whatever you're setting out to do, if you follow the instructions. It's the same with a Q-tip. You know, why would you design a Q-tip if it wasn't meant to clean ears? So now that we're talking about the Q-tip, you know, you when you're using a Q-tip, you know, you pick a good sturdy Q-tip. Don't get the cheap stuff. You know, cotton Q-tip, okay? And what I do is I like to when I show clients how to do this, I always tell them to find the cotton end of the Q-tip here and then follow it down to the end of it, okay? And then back off of it a little bit. And then hold it like this, okay? Now, why not any further than that? Well, because those two glands that I told you about are located no farther than that portion, that point in. I like to call it the wax manufacturing plant. And anyway, so if you go screwdriver in your your Q-tip down in your ear, you're actually pushing wax back where it doesn't even belong. It goes way past the manufacturing plant and it gets stuck in there, forms like a scab, building that rock, and next thing you know, you're impacted and can't hear. So well advised to not go any further than the end of the cotton. So find the end of the cotton, back off of it a little bit, give yourself some play, hold it like that. You're creating a hedge or a wall. And here's your ear canal. It stops. So you've got a stopper right there. It can't go any further than that. Okay. So now the other thing that I would recommend that I do for myself is 3% hydrogen peroxide. I love this because it's what I use to clean ears with every day. Not just my own, but clients. Okay, and it's cheap and it's effective. You can just get it anywhere. I do recommend do not go over 3%. It's just too aggressive. It can dry out your ear. Even overuse of 3% hydrogen peroxide can dry out your ear. So if you're one of those people that have a dry ear, you don't want to do this every day or other day, maybe once or twice a week, the most. Okay. So 3% hydrogen peroxide. And what I do is I'll take the cap off like this, and I'll just pour a little bit in there. Okay. Just enough. All right. So I've got my peroxide sitting here. And what I do is I'll just dip it in there like that. Okay. So I've got it, and then I'm gonna take it and I'm gonna insert it right into my ear, just like that. Okay. No further than that, and leave it in there. And I'll do both ears. And I'll leave it in there to marinate for a couple minutes. Generally, my practice is I'll do it while I'm brushing my teeth. And the reason being is because I'm looking at myself in the mirror. You know, I'm not walking around nonchalantly and bumping into any doors or anything like that. We definitely don't want to jam that Q-tip through your ear. It definitely would not be a good thing, and you'll be going to the hospital likely. Okay, so pay attention. No abrupt movements. I like to do it while I'm brushing my teeth because I'm looking at myself in the mirror. You may hear some crackle and popping because that's breaking down the wax in there. Okay, right now I don't hear anything because my ears are pretty pristine right now. So when it's done, you're gonna go up gently like this and grab a hold of it the same fashion, and you're gonna do a swirly whirly on the way out. So what that looks like is when you're in here like this, you're just going to do a swirly and you're going to work your way out. So it's been softened up and you want to work your way out, the wax out of off of the wall. Okay, you don't want to push it in any further. Now, once you get out of there and it looks like it's dirty, um, then what you're going to do is you're going to take another fresh one. You dip it again and you go back in, but this time you don't have to let it marinate. All you do is just go in there and swirly on the way out until you and keep repeating until it's clean. Okay. So, and you can do that for both ears. Hey, if you're a person that is prone to dry ears, then another recommendation is that you can use an ear gene, if you can see that there, or even baby oil. Um, but one of my favorite things to use is jojoba oil. It's deciduous. It's a plant that's deciduous to Northwest America, and it has been known to be the closest in molecular makeup to the natural sebum of the skin. Okay, so it is a very light viscosity and odorless. Okay, and hypoallergenic. Okay. Um, Yeah, so that's important that the viscosity is very thin. You don't want to use olive oil. I think that's too thick and can kind of get gooped up in there and can just kind of get rancid and nasty if anything's left behind. Okay. So, baby oil, ear gene, or just straight jojoba. Straight jojoba is my number one on the list. Eargene is good, but again, if you look at the contents, there's a little bit of alcohol in there, and alcohol is drying. I don't recommend putting alcohol in your ear, especially if you dig in there with with your fingers a lot. Don't be digging in your fingers into your ear, because you can definitely nick it. And you put that alcohol in there, you're gonna feel it. Okay. So, but if you do have a really wet ear, alcohol on a Q-tip can definitely evaporate that because it's quick drying. This is a little sponge that we use, and when you have everyone's canal is shaped differently. You know, we have two different ears, two different eyes, two different hands, two different. It's just the way it is. There's no one ear alike. So, and there are two different bends in your ear. That's just part of the anatomy. First and second bend. So water can collect in there or liquid can collect in there. So this is a sponge that we use, and you put it right into that ear if it's really wet, and it'll soak it up, and it'll expand and soak up all that excess liquid in there. It's a one-time use. All right. Hey. Um. So that's how I would clean my ears on a regular daily or by uh, daily every other day basis. So if you're wanting to do a deeper cleanse, and you're just a wax producer, then what I would recommend is doing a deep soak with the 3% hydrogen peroxide. What you would do is you would yourself a towel, get yourself in a comfortable spot, maybe on a couch or a pillow or a chair. Um, and you're going to tilt your head to the side and you'll use a bulb syringe, like they would use to drain, snot from a baby's nose. Yeah, one of those and suck up some 3% peroxide in it. Okay. And you're going to to the side and get your towel on you so you don't get all wet. And you're going to just fill that canal all the way up with that peroxide. And you'll feel it fill up. And then you're just going to take it and just kind of massage it in so it works it down in there. And you'll hear bubbles, crackles. Sometimes it'll even volcano out. So that's why you have your towel. You can just sit there and clean it off. Um, so you're going to leave that in there for 10 to 15 minutes per ear. So you do your one ear, get in there, do the other ear, and then you're going to flush it out. So a good time to do it is right before getting into the shower. You get them soaked out, and then get in the shower. And if you have a retractable shower head, you're just going to go in and just flush that out. Use different angles, warm water only, and not a hard stream. Okay, just go in there, and by that time, it's really softened up, and it should come right out. You can also use the bulb that I was telling you about, the syringe, and flush that out with clean water. Another way to do it, you could even do it over the kitchen sink or just use a water ball. One of the things I use all the time is what we call an ear lavage. And this has a special nozzle on it made for the ear. And this is, a reservoir here that would go on the side of our ear like this so that it collects any wax. So what you could do is just set that in there with your warm water and just start squirting it out, okay? You can do straight water or maybe even a 50-50 hydrogen peroxide and warm water mix. So that's another way to get it out. And you should start seeing it come out of there, okay? I wouldn't do that deeper flush no more than twice a month. Every 2 weeks, if you're a waxy person, definitely will get you cleaned out. Once it's under control, you can back off of it and just concentrate more on the regular, cleanings during the week. So that's the basic. I've got another tool here. This is called the lighted curette. And this is what we as professionals use to clean ears. I don't recommend using this tool if you're not a certified to do that. It is dangerous to be poking into someone's ear, and you can slip and you can permanently damage them. So you wanna use only professionals are recommended to use a lighted curette or any wax removal tools. Okay, so super important that we clean our ears. The other thing is, if you've got a dry ear, what you can do is take a Q-tip, and like I said before, I believe I mentioned it, but a little baby oil on it. Right after you get out of the shower, you've dried it out, and just go do a little swirly, and that'll keep it lubricated. I do recommend that you drink a lot of water. Hydration is always important. Too much alcohol or smoking, things like that can dry out your skin. So if you have any other questions, you can definitely go to my website, hearclearamerica.com. You can email me at hearclearamerica@gmail.com. Thanks for watching. Please do subscribe below. And we're going to be doing weekly videos, educating folks on all things audiology. There's a ton of information that we can talk about, and I just believe in empowerment, education. That way you can navigate through the whole hearing dilemma safely with knowledge and some confidence. Okay? So thank you for watching, and we'll see you next time. Take care.